First on the agenda, can I get an approval of the orders of the day?
So moved.
All in favor, say aye.
Aye.
Motion passes. Can I get an approval of the minutes of the meeting on January 28th, 2025?
So moved.
Second. All in favor, say aye.
Aye.
Passes. Next up is our board reports, which there are no board reports, I'm sorry. David is going to now announce our Excel award winners.
Thank you, Madam Chair. I have privilege of getting to recognize two of our Excel award winners today. And I'm not sure, is Papa Sean here?
Yes.
Oh, there you are. Come down here and join me. All right, I'll flip it over that way. Okay. I want to come stand close to me. I'm not going to fight you, all right? So our January Excel Award winner is Papa Sean Chaco, and I hope I'm pronouncing that perfectly. All right. He is a social worker and case manager too in our integrated case management. He's been a member of the SMH team since 2007. And I'd like to share a few of the many accolades that his colleagues submitted in his Excel nomination. Papa Sean is an expert in his role as a social worker and an invaluable resource and mentor to new ICM staff. He's always willing to help coworkers and offers without hesitation to cover the department after hours. He's especially a star in managing patients and discharge challenges. Papa Sean creatively finds solutions to complicated cases and advocates for his patients on a daily basis to make sure they get the care and service they need. He is always patient, even amid the most difficult circumstances. He always works incredibly well with all the areas of the interdisciplinary team. We so much thank you on behalf of our patients, our community, and our staff for everything that you do. Thank you so much. Congratulations.
Thank you so much. This is a great place to work. I really enjoy what I am doing. Thank you.
It's all up to you. All right. Thank you. Okay, next up, we have our February Excel Award winner, Angela Duchin. Angela, come on in. How are you? Congratulations. I'm going to say some nice things about you too, if that's okay. Angela is our Excel Award winner for the month of February. She is a senior payroll specialist in corporate finance. Angela has been a team member since 2020. Colleagues describe her as a consummate professional. Her diligence, willingness to learn and assist, and her dedication to coworkers reflects her strong work ethic. She confidently manages challenges with grace, and most importantly, she helps ensure that all 10,000 plus employees are paid on time and accurately every pay period. Angela has proven year after year that she is committed to excellence, not only in the quality of her work, but in her relationships with others. Her peers say that collaborating with her is always a positive experience. Angela also has a keen sense for detail and a thirst for knowledge. No task is ever too tall for her, and she does everything with a smile and a can-do attitude. As one coworker summed it up, her enthusiasm, energy, and sense of humor make coming to work an absolute pleasure. Thank you so much for everything you've done.
I agree with Papa Sean. It's a great place to work, and it's really nice to be recognized. Thank you.
On behalf of the board, we thank you both. I think Papa Sean said that. Thank you. Okay, next up is our medical staff reports. Dr. Fiorica.
I have nothing to report this month.
Okay, thank you so much. Dr. Hurwitz.
Thank you. Ladies and gentlemen, of the board, Madam Chair, today I'm asking for a motion to approve the delineation of privileges for the following: the SMH Sarasota Advanced Practice Provider General Medicine, Emergency Medicine, Gastroenterology, Hospital Medicine, Urology, Pediatric Gastroenterology, Pediatric Hematology Oncology, Pediatric Infectious Diseases, Pediatric Neonatal Perinatal Medicine, and the SMH Sarasota Pediatric Neurology, all as recommended by the Sarasota Memorial Hospital Sarasota Medical Executive Committee.
So moved.
Can I get a second? Thank you both. All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. And Dr. Perrin, is he on? Dr. Perrin? Do you want to take his Dr. Furica?
Yes, the recommendations for the Venice, SMH Venice, the same policies that were just mentioned for Sarasota campus are also pertinent to the Venice campus that were just mentioned in the previous, recommending a motion.
So moved.
Second.
All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. Next, our secretary's report. Nick?
Thank you, Madam Chair. Board calendar for April and May, Tuesday, April 22nd, 2025, 9:30 to 9:30 will be a closed session of the board. 9:30 to 11 will be a meeting with the Quality Committee. 11 to 12 will be an educational workshop. On Tuesday, May 20th, 2025, 9 to 10 will be the Human Resources Committee. 10 to 11 will be Mission and Planning Committee. 11 to noon will be the Governance Effectiveness Committee. 12 noon to 12:30 will be a closed session of the hospital board. 12:30 to 2 will be board lunch, issues and financial review. And 2 to 4 will be the board meeting.
Thank you so much, Nick. Next up, our treasurer's report, Kevin Cooper.
Thank you, Madam Chair. As part of my report today, I need to cover approval of bad debts and charity care. And for that, I move the approval of the bad debts and charity care for January 31st, 2025 in the amount of $31,156,000, and for February 28, 2025 in the amount of $27,741,000.
So moved. All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much. Next up is Jen Rosati, our new CFO, to go over our financial highlights.
Good afternoon. I will be presenting the financial highlights from February 2025, month to date, and for the 5 months ended February 2025. First, our total revenue. Month to date, actual total revenue of $174,453,000 versus a budget of $175,289,000. Year to date, actual revenue of $849,548,000 versus a budget of $876,965,000. Our total operating expenses for the month, $159,647,000 versus a budget of $163,285,000. Fiscal year to date for the 5 months, total actual $787,493,000 versus a budget of $827,521,000. Income from operations for the month, $14,806,000, resulting in operating margin of 8.5% versus a budget of $12,004,000, resulting in an operating margin of 6.8%. Fiscal year to date, income from operations of $62,055,000, resulting in an operating margin of 7.3% versus a budget of $49,443,000, resulting in an operating margin of 5.3%. On our February year-to-date statistics, our average daily occupancy total of 946 versus a budget of 954. Our admissions and observation cases, actual 35,856 versus a budget of 35,332. For Sarasota, our average acute length of stay was 4.5, and the same for Venice was 3.75. Additional February year-to-date statistics, total surgeries, 14,030 versus a budget of 14,479. Births, 2010 versus a budget of 1,914. Our total outpatient registrations, year-to-date through February, 256,624 on a budget of 257,932. Our emergency care department registrations, actual 76,548 on a budget of 76,639. And last, our case mix index fiscal year to date for Sarasota, CMI all 1.91. For Sarasota, Medicare only 2.00. For Venice, CMI all 1.48. And for Venice, Medicare CMI 1.49. And that concludes my report.
Thank you so much. Thank you so much. Next up is our committee reports, and our first one will be finance. Kevin Cooper, as the chair.
Thank you, Madam Chair. Recap of the Finance Committee meeting from today. First on the agenda, the committee approved the minutes of the meeting from January 28, 2025. Then we received a report from our newly appointed CFO, Jen Rosati, who just spoke. She gave kind of an educational overview of the finances of the healthcare system, which included kind of a look at the finance team, healthcare industry trends, and kind of balance sheet and income statement overview for the board to review. No action was required of the committee or the board. Following that on the agenda, our Chief Legal Officer, David Evans, presented a resolution that allows for the adjustment of our current per diem and subsistence allowance to be in line with the federal daily rate for combined meals in Sarasota County as defined by the U.S. General Services Administration. But then also we aligned our mileage reimbursement with the standard mileage rate established by the IRS every year for the staff that are traveling for work here at the healthcare system. And with that, I would look for a motion to move that the Sarasota County Public Hospital Board of the Sarasota County Public Hospital District approve the resolution recommended unanimously by the Finance Committee, which establishes a new per diem subsistence allowance and mileage expense reimbursement as recommended by the Finance Committee.
Second.
All in favor, say aye.
Aye.
Any opposed? Motion passes. Thank you so much, Kevin.
Thank you. And then closing out our meeting was COO Jeff Limbacher, who presented an update on the current payer landscape here in the healthcare system, including our payer mix, the commercial insurance and Medicare Advantage landscape, and a timeline of our major commercial insurance contracts. No action was required of the Finance Committee or of the board, as it was just an update. And that concludes my report. If there are any questions.
So thank you so much. We had Mission and Planning, Sharon Wexler Peters as chair. Can you please fill us in?
Thank you, Madam Chair. The Mission and Planning Committee met this morning. There were two presentations given to the committee. The first related to our EPIC project, and the second related to the behavioral health services offered in the Cornell Behavioral Health Pavilion. Pam Ramhofer, Chief Information Officer for the healthcare system, began by giving an update on the work of the EPIC Steering Committee to finalize the guiding principle for the project. Pam also presented and presented information on SMH hiring efforts, as well as the creation of operational work groups. She also provided information on EPIC training that will take place during the months of April and May. Next, Jeff Limbacher, Chief Operating Officer, presented an EPIC risk mitigation plan and discussed strategies to lessen risks during the rollout of the EPIC program. The second presentation was an update of the behavioral health care services provided in the new Cornell Behavioral Health Pavilion. Terry Cassidy, Executive Director for Behavioral Health Services, reviewed national and local trends in behavioral health services and provided a comprehensive review of the services offered here at SMH. Terry provided an update on the growth of both inpatient and outpatient services provided at the Cornell Pavilion. And that concludes my report, Madam Chair.
Thank you so much, Karen. Next on our agenda is our President's report, David Barrender.
Thank you, Madam Chair. I'm going to start, as I do every month, with our operational report card. And just to orient you to the sheet, the left-hand side is our 5 different areas of focus that we look at. The middle is the goal that we have. And then finally, on the right-hand side is our score or rating. So under the focus of service, we have a goal of having our likelihood of recommending out of our 10 areas that we survey, 8 or more of those to be at the 75th percentile. Happy to report that we are exceeding that goal, and 9 out of 10 of our areas are greater than the 75th percentile. I'll show you the detail on that here in the next slide. In the people area of focus, we have we look at our retention rate as far as employees that have been hired within the last year that are still with us, and have been as full-time employees, full-time and part-time. We have a goal of retaining at least 83%. I'm happy to report we're exceeding that goal as well at 92.4%. In the focus area of quality, we have our infection prevention rate, which is our combined overall standardized infection rate, being below 0.8. Just remind the board that the national average on that is 1.0. So we already set our goal pretty aggressively, but I'm happy to report that we're exceeding that as well, 0.48. In the area of focus of finance, you've already heard from our CFO, but we have what we look at is our operating margin being in a goal set at 5. We are projecting to exceed that at 5.7%. And then finally, in the growth area, we have 2 goals. We have both our inpatient admissions / outpatient observation patients. That goal is at 82,000 for the year. We're just over that, projecting over that at 85,600. And in outpatient registrations, having a goal of 1.224 million, we are projecting to exceed that as well, 1.307. When looking deeper into our patient experience report card, once again, the far left, you have the likelihood of recommending the 10 areas that we survey. The middle is what our actual score is. The next column over is the national median score, and on the far right is the 75th percentile. Once again, happy to report that we are over the 75th percentile at or over in 9 out of the 10, one being inpatient rehab with 1 point off. So congratulations to all. Next up, we look at our an award that we had. SMH earns the Gallup Workplace Award. Sarasota Memorial has won Gallup's Exceptional Workplace Award for Engagement for 2025. This honor recognizes organizations that have attained world-class performance by putting employees first and setting benchmarks for excellence in the work environment. Sarasota Memorial is a 4-time winner of this Gallup's Award and one of only 62 organizations worldwide to earn the honor in 2025. Award winners have rigorous criteria, including high qualifying participation rate on the 2024 employee survey, benchmark level engagement scores, and overall performance excellence. 96% of our staff took the survey in 2024. We were also named among the world's best hospitals. We were recognized as that from Newsweek for the 7th annual global ranking of hospitals. SMH has been recognized every year since the global rankings began in 2019, and is the only hospital in Southwest Florida to ever make the list. The list is based on patient care quality metrics, the surveys of patients and peers, including thousands of doctors, healthcare professionals, and hospital leaders. Money Magazine ranks SMH #1 in Florida and #25 in the U.S. Sarasota Memorial Hospital recently ranked #1 in Florida and #25 nationally in Money Magazine's 2025 Best Hospital Award. Their annual Best Hospital study examines key quality and safety indicators, including low mortality and the hospital readmission rates, as well as patient satisfaction and the experience of the hospital's doctors. It also looks at financial aspects of a patient's stay, rating each hospital's billing and pricing practices to highlight facilities that are transparent with cost of care. Money also spotlighted the top hospitals in 5 specialty categories, with SMH recognized for its cardiac, cancer, maternity, and pediatric care. SMH is #1 in the world for Watchman treatment. Sarasota Memorial Hospital has earned the top spot in the world's Watchman program, protecting more than 3,000 patients with AFib. Approved by the FDA in 2015, the Watchman device is an alternative to long-term use of blood thinners for AFib patients. The device can reduce the risk of stroke, does not require open heart surgery, and most patients can go home the same day or the next day. SMH names Employee and Leader of the Year. Each year, Sarasota Memorial selects an exceptional staff member and leader from its 10,500 member team to be honored as the Employee and Leader of the Year, and here's this year's honorees. Diane Troop Bryant, our Health Unit Coordinator on Respiratory Progressive Care Unit at SMH Sarasota, was chosen as Employee of the Year from the outstanding group of last year's Excel Employees of the Month. Diane has worked at SMH since 1987, earning the admiration and respect of colleagues through her exceptional service, extensive knowledge, and commitment to patients and staff for nearly 4 decades. Jackie Gould, our clinical manager for orthopedic and surgical department at SMH Venice, was selected as Leader of the Year from last year's exceptional group of Excel Leaders of the Quarter. Since joining SMH in 2021, Jackie has distinguished herself as an exceptional leader who is known for her thoughtful listening skills and fostering a supportive work environment that enhances both patient and staff experiences. As you all met earlier, Jen Rosati, our new CFO, she has received appointment as the Chief Financial Officer for our health system. Jen previously served as Sarasota Memorial's Vice President of Financial Operations and has nearly 20 years of comprehensive healthcare financial management experience. Before joining Sarasota Memorial in this past June, she served as the Chief Financial Officer of Broward Health Medical Center, and before that, she led the Corporate Finance Department at Memorial Healthcare System in Hollywood, Florida. She grew up in Nokomis and graduated from Pineview High School and the University of Miami. She succeeds Jeff Limbacher, who has been serving in a temporary dual role as COO and CFO. With Jeff's appointment, Jeff will now focus exclusively on his role as Chief Operating Officer during this critical time for the healthcare system. As we do each month, we have our physician lectures. This month, we're focusing on vascular health and cardiac care. I'm sure it's difficult to read the screen on this, but you can see these are all free lecture series, and even the dates in April, these fine physicians will be speaking. I would encourage you to, if you're interested, go on our website and see the complete schedule there. Also, we just ask everyone, if you do that, to RSVP. It is a free lecture, we just want to make sure we get a head count. Madam Chair, that is my report. Happy to answer any questions.
Anybody have any questions? Okay, Thank you so much. There is nothing on the consent agenda, so we will move on to public comments. Because we have 12 speakers, comments will be limited to 3 minutes. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to any item agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 3 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel to comprise of representatives of the board, medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. I will call the first name for the speaker and then the second one to follow. Cynthia Schrock will be first, followed by Sal Kilstein.
My name is Cynthia Schrock. It's been almost 2 years since I've been spoken to this board. Some of the board members are very familiar with my story. I will be giving each of the board members a booklet with each talk I've ever given here, along with the timeline my family experienced at SMH in August and September of 21. I was offered a one-on-one sit-down from Tram Hudson with the board in 23. Due to a very inappropriate statement he made to me after that board meeting, and my life being turned upside down in grief, I never took him up on it. I am now ready to meet to get the answers to the egregious wrongs that were forced on me and my family in 21. There are people sitting in this very room that have said, we need to get over all of this COVID stuff and move on. When statements like this are made, it is said only because people in leadership are uncomfortable and unwilling to ask the hard questions. I face hard questions every day since my husband and mother-in-law are gone. I can't tell the bills that come in the mail to get over themselves. I can't deal with them. I can't tell my children to get over it when they are grieving and missing their dad and grandma. Then there's the granddaughter that never got to meet her grandpa, born in this hospital at the same time he was hospitalized here. Which brings me to my point. I think those of us that suffered under the legalism of the pandemic would just like to hear that wrongs were done. That the lack of communication was so egregious, especially in my case. There were life-threatening, serious instances that happened to my husband, and I was never called. And yet, I was told after the internal investigation that I needed to accept that there were no wrongs done. But the letter from your very own Dr. Joseph Seaman, which will be in the packet I am giving you, states, the committee does feel that communication could have been improved, particularly given that many of your questions remain unanswered. That's from a very own doctor. And still to this day, my questions still remain unanswered. There are some of you on this board who have gotten to know me personally, Vic and Patty. When we have spoken, you have seen the wrongs that were done and yet seem to push me aside. There are new board members here today who will get to know my story from reading the packet I gave you. There are new board members here today who actually are very personal friends with my family members. And when you look at an organization, what do? You look at the leaders. If you want to know the temperature, you put the thermometer in the mouths of the leaders. So who here in this board is finally going to have the courage to answer the hard questions? Who will have the courage to face the hard facts? Who will be the one to no longer push me aside and hope I go away? Who on this board is ready to finally answer my unanswered questions that your Dr. Seaman talked about?
Thank you, Cynthia. We have heard you and we will follow up, so I appreciate it.
Thank you.
Next speaker, Saul Kilstein, followed by Dr. George Davis. Oh, you can just leave them at the end.
At the end? Okay.
I'm Saul Kilstein, and I'm a full-time resident of Sarasota and a big fan of SMH and First Physicians. This is not an enviable time to be a member of the SMH board. You face existential threats that most of you could not have imagined when you ran for office or accepted your roles, and that I hope you're addressing behind the scenes during your planning meetings. These include federal budget cuts that are going to impact future Medicare and Medicaid eligibility and reimbursement levels. There are going to be changes to the Affordable Care Act in 2026 that will reduce the number of people currently covered by private insurance because federal subsidies are going to be ending and regulatory changes that are going to make it more difficult for people to enroll or renew their coverage. In Florida, there are going to be increasing healthcare challenges, including an 8-fold increase in the cases of pertussis, Florida kindergartners who are not getting vaccinated for measles. There are going to be increasing immunization reductions across the state, and aggressive federal and state anti-immigrant initiatives are discouraging documented and undocumented immigrant families alike from seeking care in our communities and across the state. There are going to be fewer teaching slots needed to prepare that, and you're going to need to prepare for reduction in those slots funding as federal budget cuts impact GME funding across the country. There are going to be fewer research grants that are going to impact whether DME and pharmaceutical companies continue to fund those important grants that are taking place across the state and within your own facilities. Data challenges are going to be rampant because you can no longer absolutely trust the information being put out by CDC, NIH, and FDA. So reports on accomplishments of the past, the performance of your institution are important. And every time I attend these meetings, the information you're listening to are that which you've accomplished in the past. You have to start having serious conversations of what the next year, the next 2 years, the next 5 years are going to look like. Invite your representatives to visit your institution. That's not lobbying. That's telling them the reality of how important your facility is to them and their constituents. You have a job to do. You need to look forward, not just back. Thank you.
Thank you, Seth. Next up, Dr. George Davis, followed by Sherry Weinstein.
Hello, board members, Chairwoman Mark. Thank you for letting me address you today. I'm Dr. George Davis. I'm a family physician for over 35 years, a consultant in palliative care, and I have a master's degree in bioethics. And there's a serious ethical challenge coming your way as a board. I am honored to have served on your ethics committee as a community member. And yes, I was a candidate for this board in the last election. Congratulations to those who won. I do not feel bad about losing because the election brought forth issues that were raised and brought to the public's attention and are still with us today. Issues like maintaining scientific standards and maintaining compassion and the excellence in the care that you give here at Sarasota Memorial Hospital. Today, there is an increasing pressure to reduce those scientific standards, to promote unscientific treatments, and to spread medical misinformation. This is disinformation now coming not just from Tallahassee, but also now from Washington, D.C. This pressure will adversely, will urge you, will pressure you to adversely change, one, policies that support the compassion and excellence in the care you give. Care that is based on guidelines from recognized national
professional and institutional associations. That excellence policy is based on beneficence and non-malfeasance. That is, not doing unfounded treatments, giving those to patients. 2, adversity effect policies that will keep SMH open to all. The principle of justice, available care to all. And 3, policies that support the professional integrity of your excellent doctors and nurses. I urge you to resist this pressure of disinformation, and I urge you, and I will applaud your efforts in doing so. Thank you.
Thank you so much. Next up, Dr. Sherry Weinstein, followed by Peter Corey.
I'm Dr. Sherry Weinstein, and I've been on this SMH staff for 25 years, and for 23 years of that time I had a spotless record. Respectfully, I would like to have an extra 30 seconds because when I speak quickly, people don't understand. So if you can grant that.
I don't think that's fair to everybody else. I'm sorry.
I happily welcome the new board members and council, which I think will allow the board administration to take a fresh look at some of the concerns of its constituents. SMH has driven practitioners away from the hospital. I'm retiring by adding 2 physicians and a nurse practitioner to take my place at the concierge practice that I founded 20 years ago. I did that to protect my patients and staff from the possibility that SMH would continue its sham peer review of me and try to take action against my license. I was the only doctor that spoke up on staff and the prior co-chair of the QI committees who asked publicly about the protocols for COVID and about the safety of the COVID vaccines. For my actions, I was taken off of the QI board, I was brought before the Chiefs Council, and have had nearly all of my cases at the hospital reviewed for issues like prescribing vitamin C and vitamin K to a patient and using FDA-approved drugs to treat viral septic shock with complete recovery in these patients. No patients were ever harmed and no patients ever had communicated any disinformation or any complaints against me. With Fauci out of the office and controlling the purse strings of millions or billions of dollars of funding, we have now more studies coming out showing the association between vaccines and medical issues. This and DNA contamination fueled our Department of Health to issue warnings regarding the safety or unsafety of these vaccinations, and the fact that it was impossible to adequately give informed consent for these vaccines. And they were given at this hospital. Your own notepad says, see something, say something, feel something, say something. Dozens of us have been saying something for 4 years. I've been saying something to administration since early in COVID, questioning the COVID protocols, questioning the need to give vaccinations to people that had natural immunity. I've offered to pay for vaccine adverse event reporting training at SMH. I've spent thousands of dollars for booklets that I would hand out, and I was kept from doing that. We do not report vaccine status in this hospital on a regular basis. Therefore, we're not able to track the vaccine harms. I would have asked you to have grand rounds with COVID experts like Dr. Pierre Corey, who's testified in the Senate multiple times. We're now blessed to have him as a member of our community, and he's one of my dear friends. I invite Sarasota Memorial Hospital to move into the rewarding future of researching and exposing consequences of COVID mRNA vaccinations and long COVID. We have millions of dollars of funding.
Sorry. You're out of time.
Yes, it's hard to say what needs to be said to this group in 3 minutes, and you know that.
I appreciate that. Yes. Dr. Pierre Corey and Dr. Jeff Halperin.
Good afternoon. So I'm Dr. Pierre Corey, and I recently became a citizen of Sarasota. I'm really just here to offer really my expertise if desired, and happy to share it. I've been a committed medical educator my whole career. I've won major teaching awards at a number of academic medical centers. As Dr. Weinstein mentioned, I've been called to testify in the Senate on a number of issues around COVID. And I would describe myself as a COVID expert. I've been deeply studied numerous facets of it. I've published about 15 papers on the topic. I've also, in my prior career, was the chief of critical care at the University of Wisconsin, as well as the director of the Trauma and Life Support Center. I've also written textbooks that have been translated into 7 languages. And probably most importantly, is about 3 years ago, I opened a practice which specializes in the treatment of patients with long COVID and long vax, essentially post-vaccination syndrome. I've seen hundreds of patients. My practice has treated thousands, many of them unfortunately disabled and chronically ill. Long COVID and long vax, although it's a new name, it's not a new disease. It's called MECFS, or chronic fatigue syndrome. And it is really difficult to treat. We have definitely learned, basically most of what we do is we use a lot of different repurposed drugs to try to help these patients return some of their function. But it's been wickedly complex. I mean, this is the most idiosyncratic, challenging disease I've ever treated, and I'm a critical care physician. So I'm here in this community, again, like I said, when I learn things that I think can help people, I like to offer my expertise and disseminate the information and education. So if called upon to do so, if you felt there was a need, I'd be happy to give grand rounds, lectures, and presentations. So yeah, okay, thank you.
Thank you so much. Next up, Dr. Jeffrey Halperin, followed by Tamsin Rosenweiser. Dr. Tamsin, sorry.
Good afternoon. My name is Jeffrey Halperin. I'm a full-time resident of Sarasota County. I'm someone who's used the services of Sarasota Memorial Hospital on a number of occasions. I just want to start by saying SMH is truly a gem in our community. Over the past few years, I've become increasingly concerned about the high-ranking political leaders in both the state and federal government that have pushed strong anti-science, including, but not limited to, anti-vaccine agendas. I worry that these public officials, as well as those in the public that follow their misguided beliefs, will exert pressure on SMH and have a negative impact on the public face and practice of medicine in the county. This would be a terrible loss to the community. I'm quite knowledgeable about the importance of science in guiding both medical practice and policy. I conducted an NIH-funded pediatric biomedical research for more than 25 years. I've served on numerous NIH advisory panels. In addition, I've consulted with several pharmaceutical companies to help them develop better treatments, and I taught and supervised trainees and faculty in academic and major medical centers. Thus, I have knowledge about the value of basic science and the application of scientific discoveries to the provision of excellent clinical care. I'm particularly concerned about recent misinformation that's being spread both locally and nationally about the risk of vaccines. Since the COVID pandemic and the development of mRNA vaccines, which have shown to have saved more than 1 million lives, this misinformation has become a political tool and is spreading like a virus through our society. Now, a wide array of childhood vaccines, including those for polio and measles, are being targeted. Cases of polio, which were essentially eliminated from the U.S. decades ago, are beginning to pop up, and measles outbreaks are showing up in several communities with low vaccination rates. This is a tragedy that could have been easily prevented. As a leading medical center in our area, I urge the SMH board to take a strong and very public stance on the value of vaccines and the importance of every child being vaccinated. SMH doctors should not passively accept a parent's choice not to vaccinate his or her child, but should vigorously argue against that position. While in the end, parents cannot be forced to have their children vaccinated, applying pressure to do so will likely save lives. Thank you.
Thank you so much. Next up, Dr. Tamsin Rosenhauser, followed by Dr. Stephen Gafanti.
Good afternoon. In the early 1990s, the Association of American Physicians and Surgeons brought sued against Hillary for Hillary Care. She was violating the Federal Advisory Committee Act by doing things in secret. We were heard by Judge Royce Lamberth, U.S. District Court, District of Columbia. We won the case. Judge Lamberth is the man who said in a different case, quote, "The Medicare statute reads like it was written by James Joyce and edited by E.E. Cummings." In footnote number 1, he specified that he meant Joyce's masterpiece, Spinning Its Web. I'll read you a sentence from that. "The aunt, that true and perfect host, a spitter as Speen, was making the greatest spas a body could with his queen's lace swinging, for he was spizzing all over him like thins of many thing in formulation, boundlessly bliss-filled in an olivath of ories." It's chosen at random from page 417. Physicians in Medicare are supposed to follow the statute at pain of prosecution, but there is one very clear sentence, and I will read it for you now. It's from section 1801, it's the entire thing, 42 U.S.C. 1395. You can look it up on your phone right now. It's a prohibition against any federal interference. Quote, "Nothing in this title shall be construed to authorize any federal officer or employee to exercise any supervision or control over the practice of medicine or the manner in which medical services are provided, or over the selection, tenure, or compensation of any officer or employee of any institution, agency, or person providing health services, or to exercise any supervision or control over the administration or operation of any such institution, agency, or person." So, when we hear that if this institution, SMH, had not followed the commands of the federal government, that Medicare would have stopped paying the hospital and the hospital would have closed in a week, that is not true. You had everything in the law on your side. You should have said no. The government does not practice medicine. I know that the hospitals got incentives to use remdesivir exclusively, which is detrimental to kidneys, and incentives can also be called bribes. So that's the Medicare statute for you, and I hope you refer to it the next time something like this comes up. Thank you.
Thank you so much. Next up, Dr. Stephen Gafanti, followed by John Capel.
Mr. Berenger, Florida Statute 381.026 4B4, the Patient's Right to Know Provider Information Statute, states a patient has the right to know the name, function, and qualifications of each healthcare provider who is providing medical services to the patient. You know that it's a violation of this law to deny a patient his doctor's name. How would you explain that this happened in my case?
Can you please continue? Okay, if there's no further comment, we'll move on to the next speaker, John Capel. He's Dr. Gafanti.
I'm waiting for an answer.
He's not going to go over this with you. So, as the board chair, I'm asking you to please.
I have 1 minute and 27 seconds. Maybe Mr. Berenger can
You are
remember.
also asked to act with respect of this board when you're standing at that podium. So we've asked to move on to the next speaker unless you have something to say.
Does Mr. Berenger have no explanation for why he willingly ignored the law of this state?
Dr. Gafanti, we've asked you to step down, please.
Who's we?
I just asked Mr. Berenger a question. I have 50 seconds. He could answer it.
You are not going to attack our CEO at this point.
I'm not attacking him. I'm asking him a question. He's your CEO. He's supposed to be able to answer questions.
And this is not an open forum of discussion. We've sat down with you multiple times for discussion. Thank you. Next up, John Capel, followed by Ruth Brandywine.
Thank you. My name is John Capel. Recently, I had to go do a Sarasota Memorial Hospital urgent care, and with one exception, I had a good experience. So I do want to acknowledge you when you do something right. I do appreciate that. However, until you take responsibility for the crimes you committed during the COVID year, then I will continue to call out those crimes, specifically Florida Statute 782.04, first and second degree murder while committing aggravated abuse of the elderly, Florida Statute 782.07, aggravated manslaughter of the elderly, Florida Statute 895.03, RICO violation, Florida Statute 825.102, abuse and aggravated abuse of the elderly, Florida Statute 817.504, offering or advertising a vaccine with intent to defraud. These crimes have been elaborated on by the Veers Law Group in West Palm Beach. Hiding behind a white coat does not offer you immunity from prosecution. When you force a drug such as remdesivir, which you know will harm or kill patients, that's a crime. When you withhold food and water from patients, that's a crime. When you prevent loved ones from seeing their loved ones in the hospital, that is evil. When you use a fake PCR test to get a positive result, to get millions of dollars in payments from the federal government, that is a crime. Kerry Mullis, who invented the PCR test, said it should never be used as a diagnostic tool. You pressured people into taking the bioweapon, also known as the COVID vaccine. According to the Vaccine Adverse Event Reporting System, there's been more than 2.6 million serious adverse events, more than 38,000 deaths from the so-called vaccine. And Dr. Sherry Weinstein pointed out that this hospital does not report adverse events to the VAERS, which is your responsibility. So these figures that I just gave you are vastly understated. You did not care how many people you harmed or killed because of all the money you were making from the federal government hiding behind your white coats. Do the doctors and the management at the hospital follow the Hippocratic Oath, do no harm, or do they follow the hypocrite oath? Let's see how much money we can make and the patients can go to hell. Lastly, I don't take what you call vaccines, injections, God knows what. So are there any volunteers to take any of the vaccines I haven't taken? You all promote the COVID-19 vaccine, which has caused excessive damage. Would anybody like to take mine?
Thank you. Ruth Brandywine, followed by Lisa Roulette.
Good afternoon. I'd like to take a minute to personally thank this hospital. I unexpectedly had to undergo open heart surgery in December. The treatment I received in the cardiac unit was unbelievably wonderful. I mean, not wonderful to have an operation, but the care I got was exceptional. The rehab center that you have helped me immensely, and now the cardio rehab run by Dr. Morsley has got me just about back to where I was before. So thank you for all that you do. But that's not what I'm here to talk about today. There was a gentleman who spoke about some of the financial threats coming to the hospital. I didn't know he was going to be speaking. I want to focus on the threats about Medicaid. You probably are aware that currently there is a reconciliation bill in Congress, and there is a threat to Medicaid, which nationally is about $600 billion, and they want cuts of about $880 billion. The only way that they can cut Medicaid, and they are seriously considering this, is to block grant Medicaid. In other words, instead of being paid per patient for the care, they would give a sum to each state, a very small sum, and expect the states to provide any additional amounts. This is very unlikely to happen because most of the states are already fiscally in trouble. But I want to point out that what's important to this hospital is that you have a lot of children, you have pregnant women, probably half the pregnant women that you have here are on Medicaid, and you have many elderly who are not only on Medicare but are also on Medicaid. This is not a political issue, this is a financial issue for this hospital. And I hope that your hospital and others in the state are in some kind of collaboration to make known the direct threat this will be to the hospital if this Medicaid change occurs. So I urge you to consider this, and I will give you additional information if you request. Thank you.
Thank you so much. Next up, Liz Gillette, followed by Diana Draper. Lisa Gillette, sorry.
As you've heard, there's still quite a lot of pain and distrust here in our community because of decisions this hospital made with COVID protocols. We've seen patterns of these decisions continue to this present day, and that is cause for grave concern. To start to rebuild trust in our community, it is vital that you take Dr. Corey up on his offer to share his COVID treatment insights with you. He truly is a highly recognized and highly celebrated COVID world expert, and it is an incredible gift and an incredible honor that he just reached out with an offer to share his insights with you. When our world and this hospital system were caught completely by surprise during the first year of COVID, recommendations from federal agencies were bleak. Doctors were led to believe that there was no effective early treatment for COVID. Some doctors refused to accept this as the fate for their patients without thoroughly exploring all viable options. Dr. Pierre Corey was one of those doctors who dug deep, sought out best practices from frontline doctors across the nation, and identified an exciting COVID treatment protocol that worked astonishingly well, especially if used early. How was he able to do this? He sifted through study after study after study and spoke with doctor after doctor after doctor, leaving no stone unturned in identifying the best treatment options for patients nationwide and around the world. This is what most of us assumed the federal agencies were doing, but they were not. He picked up the slack. He looked for answers, and he found them. He was so successful at identifying some of the most exciting, successful COVID treatments that he was invited by a U.S. Senator multiple times to share his insights with the world. As a result, Dr. Corey became a highly recognized and highly celebrated COVID treatment world expert. What are the odds, and how incredibly lucky are we that this world COVID treatment expert is here now in Sarasota? This is fantastic news for our community because his insights are in high demand, and he's offered to share them with you and answer whatever questions you have about worldwide best practices when it comes to identifying COVID treatments. Each of the 9 board members, the 6 who are here and the 3 who will be listening remotely, all of you wants this hospital system to reach the highest potential possible. You want to save the most lives. You want to minimize suffering as best as possible. Dr. Corey offers to you a powerful way to help Sarasota Memorial better understand the best practices and insights he identified through worldwide collaboration with other physicians. It would be of immense value to our community for the board members and everyone here charged with making policy to take him up with his offer. I'm very excited. I hope you are as well. Thank you.
Thank you. Next up, Diana Draper. Diana Draper. are done with public comments, and we will move on to David Evans for any legal matters. Okay. Any other business?
Madam Chair, I move that we invite Dr. Corey to come to a workshop of the board to give us the type of information that he provided to the U.S. Senate. If the U.S. Senate feels that it's worth their time to listen to what he says, I think this board can't be heard by listening to what he has to say to us. So I move that we have a workshop and that we invite Dr. Corey to speak to us.
I think that's out of order. For David, can you?
Well, we're on to new business.
Thanks, Mr. Oki. I believe our current standing rules require for a motion prior notification to either the board chair or committee chair.
I'm sorry, I can't hear you.
I believe our current standing rules, I know our current standing rules require notification to the board chair or the appropriate committee chair to agenda an item in our standing rules. And so that's something that you could take up with either of those folks or the appropriate, normally that's done with the
In
appropriate.
the past, the board has agreed in principle.
We're not saying no, we're just saying it has to go through the
The board has
procedural
agreed in
process.
principle to having a workshop. Now, there is no committee chair when it comes to having a workshop. There's no workshop chairman committee. I mean, no workshop committee chairman.
That's right, so it would be the board chair if you thought that a workshop setting was the appropriate setting with 7 days advance notice. And the rationale for that rule, Mr. Roby, is that the board can be adequately prepared, the agenda can be adequately prepared.
When did it pass that rule?
That's in the standing rules, which were last updated within the year.
All right, I'll get together with you after when you can show it.
That's fine. I'm not saying no, just doing it in the proper procedure. Any other business? Okay. With that said, meeting adjourned.